Welcome to today's workshop on developing your net zero plans. I am deliberately wearing a green t-shirt to support this important agenda. My name's Steve, I work for him in the Northwest Coast. I'll be chairing this meeting and my colleagues Paul and Dave are going to get us started with a couple of slides about us as a network. And then we're handing over to two people who get paid to help people develop their carbon plans. So that's Gary and Martin from Carbon Happy World. Then after their slides, after about 35 minutes, we'll have some slides with 5 questions on Slido. So we'd like all delegates to answer before opening up to Q&A. So have your phones and iPads ready. We've checked it, it works fine. I think everyone's heard me make the request that everyone mutes themselves so that we reduce the interruptions and background noises. Kids and dogs and other pets are allowed in the background. And if you've got any questions, just put them in the chat, but we won't come to them until the end. And if we don't get enough time to answer all of the questions, our subject matter experts will answer them and give the answers to everybody. And we'll also be sending out a recording of this and the slides. So that's me. Dave, if you're ready to go, I'm happy to pass over to you.
Yeah, sure. Thanks. So hi, everyone. Thanks for joining. We're going to go through the Slido survey later, so once you can see the first question, if you've already done it, just leave it open for the time being. Myself and my colleague Paul have a little bit of our time dedicated to the subject of net zero. All we wanted to do this afternoon was just to give you a quick flavour of what our organisation does around net zero. We're conscious about detracting from what Carbon Happy World are going to say, so just a warning, it'll be basic and brief from us. So firstly, we've separated responsibility for innovations out into clinical and non-clinical. So all your clinical products go to Steve's team for assessment. You might then meet me and Paul further down the line to see how your product stacks up in terms of carbon. If your innovation is non-clinical, we'll be your point of contact. So the theory there is that there's less complexity around compliance and regulation if we're not looking at a medical device or something that impacts patient care directly. The likelihood is also that if you have a non-clinical innovation you want to get into the NHS, there will or should be a strong net zero element to it. So we, and that's me and Paul, we've got the headspace to consider innovations from a net zero angle first and foremost. As a small team, we've managed to get some very new links into local estate teams where the bulk of the easy wins for net zero will be. So that's like waste, energy, etc. Another area that we've got is the Health Innovation Network that we're part of. So they run events, regular meetings, product showcases, etc. to spread innovative ideas and products across the country. So a discussion with us could mean that a trust in our patch might be looking for a way to enhance their progress towards net zero, and your product could fit in. But equally, since we're connected to the whole network, it might open up an opportunity in another area of the country. We've also got responsibility over our own carbon footprint because we're part of the NHS, and we're making strides to be able to publish our own carbon reduction plan very soon. To give you an idea of what the majority of our carbon footprint is, just to be candid, it's mainly staff travel to and from work. And then part of what we need to do now is to be able to show via some kind of platform like the one Carbon Happy World have, where our carbon footprint comes from and where we might be able to reduce it. Paul's got another slide here that I'm just going to hand over to.
Yeah, hi everybody. You may be thinking, how can we get funding? We're a business, we need to make money. There are grants exclusively for net zero. There are things like National Lottery Climate Action Fund, and NIHR also do a number of decarbonising grants. So if you are thinking about, and you should be thinking about reducing your impact, if you want to sell into the NHS, look at those funding schemes as well. As David said, we do a lot of networking. We attended Carbon Happy World. They did their own sort of networking event, and at that David and I picked up a couple of contacts that we can promote their services wider in the NHS. And as David said, we're part of one of 15 Health Innovation Network partners. So we regularly meet to go through what's out there, do grants, do networking sessions, run events. And one of our fellow hens created this net zero guide for innovators. There is a link there in this slide when you get it. It goes through what you can think about with your net zero and getting your innovation towards net zero. Passing over to Gary now.
Thank you, Paul. Hello, everybody, and welcome to this workshop webinar on ESG and sustainability reporting. Next slide, please, David. So Carbon Happy World are a cloud-based consultancy company based in the Northwest, where we look at carbon accounting. That's the activity that everything you do within your business has a carbon footprint. And if you look at it, where there's carbon, there's a cost. That's the way we look at it. So besides trying to reduce your carbon footprint, we're also trying to reduce your costs. But that also then spills over into how you start reporting this. And this is what we're going to focus on mainly today, and how you can become a leader or a thinker within your sector or even within your business, because I know that some of you are probably here and I want to push this up the chain to your MD or FD, and sometimes that can be difficult and getting the buy-in. So it's how you sort of position that and how you message it. And then if you are a leader in your business, then what is it you need to do to start getting action and some results? So we use science-based targets when we're looking at our data. You can see there we talk about scope 1, 2, and 3, which you've heard about. But coming down the line is scope 4, which is about how you avoid emissions and what you do to offset them. And although the greenhouse gas corporate standard yet hasn't fully adopted it, people like France, in France and Europe, are starting to talk about scope 4. And if you Google scope 4, you're seeing quite a lot of debate on it. So for us, when we talk about scopes, we'll add scope 4 in as an add-on, which is just coming into play mainly this year. Next slide, please, David. So what you're here for today? Well, one, you want to get an understanding, maybe a further understanding of what you think ESG is, which is, environmental, social, and governance, and why you need it. We try and we give you the thinking process to see how you can relate it to your own business and what you need to do next. And the things that we see a lot when we talk to clients is there's always one person that seems to be carrying the burden. Well, it's not all on you. There are ways that you can share that burden, both with external stakeholders and with a partner like ourselves that can carry that burden with you and be able to share it amongst the company. Try not to be overwhelmed by it, because it can be quite a tricky subject. There's a lot to take in, and there's a lot of regulations. There's a lot of fluff out there. There are some bad actors, unfortunately, which will tell you what you want to hear, but that is just a fool's errand. And most of all, what we want you to put a smile on your face. We want you to enjoy it, because it's quite a novel experience to talk about your business. Instead of looking at a balance sheet, you're looking at a carbon balance sheet, and the way you look at your business will change dramatically. I guarantee that. Our experience with our clients over a number of years to see how culture changes. It doesn't happen overnight, but with the right leadership and the right structures in place, you can do it. Next slide, please, David. So where are we? So climate change in the NHS. Well, climate change has been, from 2020, has been a big topical subject in the NHS. And as you know, if you work in the sector or you work in the in the supply chain, it can be a bit of a behemoth, and trying to find your way through and try to understand what the messages are coming out of central, well, what is at the moment NHS England or the government, it can be quite confusing. And the likes of HIN, for instance, are giving some guidance on, well, what does it actually mean? And NHS set two general targets. One was carbon net zero by 2040, and we'll talk about what net zero means in a sec. And for emissions, the NHS influences but doesn't have direct control of, then they wanna, they're giving themselves another 5 years to try and get that carbon shadow, we call it, which is the influence it has beyond its direct control of expenditure. So it could be in communities, it could be in other business sectors that are not directly associated with it. That it's sort of the ripple effect of what NHS are trying to do. And when we talk about carbon net zero, what we mean is what through the best endeavours and the best actions of an organisation, can you reduce your footprint? Now, between 80 and 90%, there isn't a definitive end game on that. People say 90%, other people say 80%, and that is across all the activities in the business, and that means the supply chain. And if you're in the supply chain, sometime in the next few years, you're going to find yourself being wrapped up in this, because you also, if you want to keep your name in the game with the NHS, is going to have to start thinking about, well, how can I reduce my footprint? Now that becomes a bit scary at the beginning, but Rome wasn't built in a day, and you have to think about it in a partnership approach with the NHS, with your suppliers, with your stakeholders. It's not all on you, as I said before. It's about shared endeavours, owning the problem and sharing the solutions together. That's what we really want to be looking at. Next slide, please, David. So I talked about Scope 4. We haven't put it on here yet. It's a new concept, and one that's really exciting actually. And you might want to know a bit more about that in the Q&A. But when we talk about scopes, we talk about scopes 1, 2, and 3. And Scope 1 and Scope 2 are generally positioned around any transport that you might have on site, which is Scope 1, and any energy you might generate yourself, which is Scope 1. So that could be burning gas on your site with boilers, or it could be solar panels on your site. And then the other bit is Scope 2, which is the indirect emissions, and that's what most people do. They mostly buy from the grid. But even that can be complicated, because there are 11 subsectors of that which you can then have to delve into, particularly if you're a big importer of energy. That could be gas, could be hydrogen, but it's mainly electricity. And if you're importing that energy onto your site, into your office, then you would report under Scope 2. And just for a heads up, there are 2 main sections on this, and it's changing this year. But it's location-based and market-based. And location-based means you get it off the grid. And if it's market-based, you've identified a source of energy that you want to import into your site, and you're buying it directly. They're the 2 generalizations that'll give you an idea at the moment on energy. And then we come to Scope 3. And Scope 3 is probably where you're involved with the NHS, because if you're in the NHS supply chain, you come under Scope 3 emissions for the NHS. And what that means is that any activity that you supply to the NHS, be it consultancy, be it goods, be it a service, then the NHS will want to capture that activity and account for it themselves. Now, people get confused here, because they think, well, if I'm giving that activity and service to the NHS, why am I having to measure it myself? Well, the standards and the protocols allow for double counting, and it's not about the end number. It's about you recognising the emissions between both of you as an organisation and the NHS, and saying, well, how together can we bring this down? How together over the next few years can we develop an action plan, a strategy, some type of working group that we can start helping bring those emissions down together? Because ultimately, you've both got the same problem, and ultimately you won't want the same solution. So it's the shared endeavours that is really important under Scope 3. And for organisations, mainly Scope 3 accounts for up to 70% of all emissions, sometimes more. So you can see that it can be quite complicated. But when I said to you earlier, don't be overwhelmed, just take this step by step. Don't think it's all on you. What we do is we can take you through a process where you break it down to bite-sized chunks, where you can relate to the right organisations that you need support from, and that you need to communicate with the NHS. It's a process that you will develop, and it'll mature with your experience, and you become more used to the terminologies and those type of things. But I think this is where we think people get really hung up, because they think, I can't do it. And when you've got that "we can't do it" attitude, it's like, put your head in the sand, it'll go away. Well, I've got news for you guys: climate change isn't going anywhere. So it's a question of facing up to you and saying, well, what is it that we can do actually? Next slide, please. So this gives you an idea about where those scopes sit. So the NHS, as you can see there, is responsible for up to 25 million tonnes of carbon dioxide emissions equivalent a year, right? And that includes you. If you're in the supply chain, they've done an estimation. I went on a course about a year ago, and they showed me some of the work that had been done from various universities across the UK. and how that supply chain influences their carbon footprint, and it can be quite scary. But you can see there that when I explain scope 1 and 2, you can see with scope 3 is just by the scale of the graph itself there, the diagram. You can see what it includes. It basically includes everything you do, all the things you buy and sell, all the services you provide internally within your business, the activity of your employees when they're under the remit of the company. All that has to be accounted for, and that can be that can be a moving feast. But if you can get the right processes in place, you can start understanding, well, where is it that we sit with X, Y, and Z across our scope. Some of them won't apply to you. If you're not leasing, or you're not renting, or you're not producing waste, for instance, then they won't apply to you, and they can be omitted. So it's filtering down what the big emitters are within your business, and then acting on them, but not forgetting as well that there's a lot of other activities in your supply chain which you would have to account for as well. Thank you, David. So here's a question for you, and I think Dave's going to have put this on slide later on, but if you can ask yourself, what type of business are you? So this was a survey done by the British Business Bank last year, and it surveyed about 2,000 companies and asked them, well, what maturity level are you at when it comes to sustainability and ESG reporting? And you can see quite clearly there that between maturity level 1 and maturity level 2, were effectively 75% of UK businesses are not in the position to actually start acting on this. And you've got maturity level 3, which is doing a bit, and I would count things like, oh yes, we've moved to LED lights, we put solar panels on the roof, we segregate our waste, we might we put an EV charger in the car park. That's the sort of maturity level I would identify as 3. If you're thinking about it and you're thinking, oh, it's not really to do with me, I've got my head in the sand, then you're in good company, because there's over 55% of companies thinking like that. And then there's a very small number, around about 3 or 4%, which are actually doing something positive about it. And they're the leaders. They're the ones that are going to have first mover advantage when it comes to more stringent type of reporting and auditing that's going to come down the track. Thank you, David. So just to recap on that, so you've got maturity level 1. I mean, this gives you an idea of what type of sectors you're probably looking at. So it's primary industry and transport, construction, with the higher emitters that probably don't really want to look at how we can look at what they can do in terms of activities. In level 2, you've got services, which, small businesses that think, well, I'm only driving down the road, there's only 5 of us in the office, I don't really need to do anything, and we haven't got the capacity in the business to do it anyway. And then when you look at levels 3 and 4, you can see that those that do have a bit of the structures around them that they can start delivering, and there's some appetite within the organisation to get things moving, and that's the driver that can really start making the change. And then when you get to maturity level 4, which is the ones who are the most nimble, they're the ones who have the leadership, the right structures in place, and have started doing the processes properly. Thank you, David. So why are we here? Well, the NHS developed the Evergreen Sustainable Appliance Assessment, and it's an online tool by which, for some tenders and some parts of the NHS, that they insist that companies actually apply for this type of assessment to be on their contractor list. And we've helped a few companies on this, and where those companies have embraced it and have said that it's something they need to do because they're being told they want to do it. They never really thought about it before. They're being forced into that position. It's made them. It's actually changed their thinking within the business. And we've got some good examples where, through this actual reporting of their carbon footprint, there's companies like West Coast Workwear, that's in Southport in near Liverpool, where they have substantially increased their contract with the NHS by promoting their carbon footprint as a positive endeavour they've achieved, and they've managed to grab more business because of it, and quite a substantial lot of business actually. It's gone up over 200% in the last couple of years, which is really significant for them. So it can be complicated, but again, if you find the right company that can work alongside you and get the assessment done, it's a continuous assessment, so you have to report every year on it. You have to make sure that you're up to date and you're showing progress in your emissions. But once you're in the process of understanding where you're going, then I think it becomes part of the culture of the of your organisation. Next slide, please. So where the Evergreen Sustainable Supplier Assessment, well, it looks at the summaries of what your criteria, the further you get down the line when you're doing your ESG reporting, the more you mature you become about it, the more you're experienced in discussing it with your colleagues within your supply chains and with the NHS as maybe your primary customer. You get to that level of understanding where you're at, and in the first few years, it's a bit of a haze because you're still trying to get all the figures together. You're still trying to understand what these mean in terms of activity levels within your business and what the impact will have on your business, because some of these things, might have a negative impact in the short term. There might be increased costs because you've got to bring people in, and you have to start maybe thinking about how some of your supply chain works because they're not working well. But the fog lifts and you can start talking about, well, I can see a strategy here and I can start planning out over the next 3, 5, 10 years on where my business will go when it comes to my carbon footprint reductions. And that's what you want to tell the NHS, you want to tell your suppliers as well. And then you start thinking, well, if I can do this for the NHS, who else can I do it for? Who else can I help? Who else can I engage with? That we can start having that conversation, because there becomes a level of confidence within your business and within your staff, and even a sense of pride that you're actually doing something really worthwhile. Next slide, please, David. So why would you do it? Well, in the NHS, if you've got to keep, the Evergreen assessment comes your way, you have no choice, because if you don't put a submission in, then you're more than likely going to lose some business. But there can be financial savings in what you're doing. There is legislation coming down the track for small businesses. We're following Europe on this, although it won't be mandatory. It will be looked on from the public sector, and in the New Procurement Act, there's actually a phrase in there which actually says that we will look more favourably upon organisations that are prepared for their carbon footprint reduction in going forward. Of course, it improves your brand, and particularly with the younger generations, it really helps with recruitment and retention. And then when you get to the point where you start understanding what your footprint is about, you begin to understand the pros and cons of some of the actions you're going to take. It makes you more resilient for what's coming down the track, and particularly around climate resilience, about maybe some cost resilience as well with the uncertainty going on around the globe. Thank you, David. So, see the questions we had. We had a lot of questions. There's a lot of things that it's all too complicated, can't be bothered. But these are the most common question that we hear is, I want to start my sustainability, but I don't know where to start. And all of you are at different points in this. As I said at the beginning, you might be a senior manager that wants to get on the agenda of the board. You might be a leader that wants the buy-in of your board and the buy-in of your staff. You might be forced down this track of doing it because your customers are saying you should do it. So everything depends on where you are. And you might have put some LED lights in. You might have planted some trees. On their own they're great, but together as a story and to show it in numbers and with data is really more powerful. And for our processes, there's a 12-point process we follow, and it's making sure that you go in that order and you systematically start looking at every aspect of your business, because it's surprising when you get into it. It goes from everything from your actions in your day-to-day to how you communicate and how you apply for tenders. Thank you, David. So why does it matter? Well, when we look at our carbon emissions, our environmental, on the E and the S and the G, we look at our emissions, we look at how efficient we are. We can look at water scarcity, which in some parts of the UK is a real problem. Waste is a big problem. Food waste is a massive problem in the NHS. And if people don't understand what the wasting and the impact it has on our environment, then we've got a real problem. And I think trying to get that across in an organisation, no matter whether it's in the NHS or any organisation that uses a lot of food, it can account for up to 30% of the world's carbon emissions, food. So you can see by just reducing the waste and looking at what type of emissions come out of the food that you're cooking can have a significant impact. And there's the pollution mitigation, which particularly from a public health perspective can be really important. With the social, if you can't look after the planet, you're not looking after your people. Ultimately, the planet we live on is dependent for our survival. It's got to be functioning, it's got to be livable. And you can take that to an extreme. We've got the right working conditions. Are you engaging, talking to your staff enough? Are you engaging with stakeholders? All those type of things have got to come through when you start going through this. But as I said, I'm speaking about it as a whole at the minute, but you break it down into step by step and you'll get there. And then with governance, you got to make sure that things are in the right order, in the right structures. You've got to make sure that you've got the right policies in place, particularly when you're talking with public sector bodies now. There's a lot of things about how you report and the ethics that you go behind it. Thank you, David. Okay, so these are just a quick ones here. So this is basically, this is why we're here, basically. There are 9 climate impacts parameters that we work to. And you can see here that where we're in the green circle in the middle, that means that we're doing all right. Right, we're still within the parameters of living within a safe environment on this planet. But then when with those red ones that you can see, and the greens and the oranges, the orange and the greens, the oranges and the red, that's we're in real trouble. And that's what we have to concentrate on. And we can, if you want to know more about that, we can send you a bit more detail on it. But you can see that the big one, novel entities, this is things like burning of fossil fuels, burning of land, the emissions coming out of exhausts, the emissions coming out of buildings, those type of things. And you see that's a real problem for us. And that's everything from aerosols that we spray on our bodies, right through to some things like we'll do with air conditioning, for instance. Just to give you an example. Do you want to go through the next slide, please, David? As I said to you earlier, where there's a carbon, there's a cost. The planetary boundaries are the ones that we measure when we start looking at our climate impact. These are the things that we start looking at. And you can see there that, I've talked about it before, the biochemical flows is probably out of our control a bit. Sometimes when we start looking at how we deforest and how we degrade land, that can cause a big problem, particularly when natural events occur as well. That just exacerbates the situation, as an example. But as Paul and David can attest, I can go and talk about that for about half an hour. So it's just give you an idea about where we're up to on that. Next slide, please, David. Stakeholder engagement. And what people tend to do is they tend to be all over the place with it. They'll tend to talk to whoever they can get, whoever will listen, without really understanding what they're trying to achieve. And so what we do is we follow this 4-point guide, which basically says, start with your core business, start with what you know, and who you can trust, and who you can communicate with, and to get that message right, to tell them what you're doing, because they will become your advocates going forward. It's really important that you get the buy-in from your customers and your own suppliers, as well as your staff. That's really important. And when we talk about staff, we mean about not just talking to them, but listening to them as well and getting the feedback. And when you get that core you start moving on to what your values are, how you can start talking to industry, and how you can start talking to your communities and social. So it's a process you go through. And what people tend to do, they'll tend to jump around a bit and be a bit inconsistent in the messaging, and not really have had the people around them who really matter to communicate. That's the real thing that they want, the buy-in, and also the belief in what they're trying to achieve. So that will be the core about what we try to get through. And that's after about a year, you start thinking like that. That's where you start getting, an understanding of what you're about. Next slide, please. Okay, so who should you engage with, and why should you do it? Well, as I just explained there, it's the core that you want. It's the people who got the shared endeavors, the most common the most commonality between organizations. That's what you want to be looking for. You want to put people who want to work with you, who can start understanding and sharing, helping you develop your carbon footprint strategy, your governance strategies, and your social strategy. Next slide, please. Okay, so this is what a normal governance structure is on the left, which is the in the blue, which is what we look at. That's our daily, you know, that's what we look at in our monthly reports, we look at in our boards. But what ESG does, it looks at other things as well. It looks at the structure of your business. It looks at how you report. What are the climate risks within your business? What is the strategy to mitigate those risks, or look at them as opportunities? How do you start measuring it, and what do you measure? And then you look at what's called double materiality, and that's where you bring the two governance principles together. So you're looking at what effect, positive and negative, will an ESG policy have on your balance sheet? Because clearly, if you're not a functioning solvent company, then you're not, you know, the ESG bit doesn't matter, but it can actually help and improve that if you wanted. So next slide, please. Okay, so just a quick, if you've got a pen and paper, what does governance look like to you? And if you were starting it, what would you start with? And I might just shout these out at the end, David, if people write them down, so I can just see what you can mark themselves out. I believe no one will cheat. That's great, thank you. So this is the type of things these are the type of organisations, standards and frameworks that we can report against. There's a barcode up there if you want to know more about these, but basically our systems allow you to report against any of these standards, no matter where you are in the UK or around the world. Next slide, please. So if you want to know a bit more about us, just click on one of those QR codes and get in contact, and we'd be happy to have a chat with you going forward. Back to you, David.
Yep.
Cheers. So we're back to another QR code now. I don't know how many people have already got this open, but there it is for those who haven't. Just give a few seconds before we actually move it on to the question. Gary, feel free to jump in to just re-explain the maturity level, but it's fine if you don't need to. And I'll just move it on to the first question. So hopefully we'll see some votes come in. There we go. That's good. It's reassuring. And just to give an idea of where we are as a Health Innovation North West Coast, I think we're probably between 2 and 3. So we're nowhere near 4. And we're probably not 1, but yeah, between 2 and 3. Just give 10 more seconds for any more to come in.
Like the Grand National.
Yeah. I'm not going to try and commentate on that.
I think it's quite it's indicative of the reporting, really. You know, there's a lot more maturity level 2 than there is in more broadly, and there's a lot more maturity level 4, which is interesting as well, than the national average.
I'm just going to move it on to the next question. So how confident are you that you know what scopes 1, 2 and 3 mean for your business operations? I know we've gone through it for the NHS, but it'd be interesting to know what you think about for your industry and your business.
Interesting.
Yeah, I'll just give it another 10 seconds.
With this question as well, we are struggling because we rent our offices, so things like waste and water, they are dealt by a third party, but we need to account for that volume in our scopes. So some of you may be in a similar position.
Right, I think that I was going to say they've stopped coming in, but they have not. And I think I'll just move it on now. So do you have dedicated member or members of staff to look at reducing your carbon footprint? And again, just to give you an idea, Health Innovation North West Coast is sort of between 50 and 60 employees. We don't have dedicated members of staff whose day job it is to do this on its own. Mine and Paul's time's probably about 10 to 20% of our week.
Well,
Okay, great. And I'll just move it on to the next one. So that was a nice short question. Yeah, so if yes, do you have any level of training or expertise? And yeah, not applicable is if you answered no to the last one.
wow. Yeah.
We'll just give it 10 more seconds. Okay, and I'll just move it on. So this is the last question. Is there a pull from your existing contracts outside the NHS to demonstrate any carbon reduction or for evidence of a carbon reduction plan? So for not applicable, that's mainly for people who are have new products and don't have existing contracts. But if you've answered no, it's not going to mess the poll up.
For those that are answering no, the chances are that it's coming.
Yeah.
We've applied for some bids where they required a carbon reduction plan to be published, which we did have, but it was a bit. We're still educating the rest of the organisation as to what David and I are doing. So they came to us and said, "Help!" And thankfully we could put hands on the information that they needed.
Yeah, and I'll just give it another 5 seconds. Okay, and that's the last slide. So Steve, I'll just stop sharing now and over to you.
Yep, thank you. First of all, Gary, for your presentation, it was really good, and well done, David, on those 5 questions on Slido. So we want to open it up to any questions from the delegates in the audience. And you can just raise your hand or put something in the chat.
There's a few questions in the Q&A already, Steve.
Do you want to just read them out, Phil?
Yeah, 1 second. So there's one from Lucas, who I think you guys can read it as well, but they want to supply the NHS with Ampio automation solutions, integrating it with more advanced medical sensors, detect people's heart rate, temperature, breath, sleep, and detect the fall of SAG, calling for help. Reducing human alternative monitoring. Also, with standard automation, integration, lighting and heating will reduce 30% of electricity. It can be installed as a retrofit, which will improve the wall switches and add the ability to install those in bathrooms. So the question is, how do they start and how do they find and secure an NHS contract? So it's obviously quite a wide-reaching question there.
So, Lucas, are you still on the call? Are you currently supplying to the NHS, yes or no?
Sorry, no, not right now.
Okay, so is your question more about NHS, selling to the NHS, or a net zero question?
NHS, yes.
Okay, then if I'll pick it up with you offline if that's okay.
Sure.
And then there's another one from Matt Langford who says, outside of carbon footprint, how are other sustainability factors such as plastic waste, use of finite resources, use of toxic chemicals and materials taken into account by the NHS?
Is that one for?
I could answer a bit of that if you want, Steve.
Yep, please.
Yeah. So the use of plastic is within packaging and supplies is actually a fundamental part of your NHS carbon footprint and your carbon footprint generally. And when it comes to novel entities, which are the toxic gases you're referring to, the likes of nitrous oxide, which is obviously a big use within the NHS, but it's also a massive carbon footprint equivalent, something like 260 times more potent than carbon dioxide itself. There have been endeavours to try and reduce that amount of nitrous oxide used in the wider NHS because it's expensive. 2, also it's actually becoming a rarer commodity, and 3, it does have a massive carbon footprint.
Okay, that sounds like a good answer. Do you
Just
mind
one
reading
more,
out,
Steve. Sorry.
Yeah, thank you.
So there's a company called Highbox who would put themselves at maturity level 4. Their question is, what is the forum through which they should present their carbon reduction solution to the NHS?
So they should go on to the Evergreen, the Evergreen link that it's on this presentation, and put it there as part of the process of the tender submissions to the NHS. At the moment, the NHS is not validating a lot of these submissions, but I understand that's going to change, and there's going to be some type of audits done on these on the reports and how those reports progress in the future.
Okay, well, now's the chance for anyone to.
Sorry, Steve, there's just one more, or maybe
Okay.
2 more. They've just popped up now.
Okay.
Marcus just asking, what guidance and tools are there for the carbon footprint of AI tools? I know Gary knows a little bit about this. How might AI use be accounted for? It's understood that AI uses a high level of energy, and that would be visible at the AI platform server rather than the company.
So yeah, so you've got to so with all data, you have to record the amount of data you're using in gigabytes or terabytes, and that then because AI is just coming into the fore, particularly in 25. It depends where your server is going to be set. So if your server is an AI server in the UK, we can relate the amount of energy that the server is using in the UK per gigabyte against the energy emission factors within the UK, and also what's called the PEU number, which is its performance. The other element of this also is water, because AI uses a lot more water because a lot more activity going on. There has to be a lot more coolant of the servers within an AI center, and that's something that we have to start accounting for as well in any year reporting from 25.
I was at an event in London about a month ago, and a very well-respected AI professor from one of the big universities said that a 50-word email that goes through ChatGPT needs a pint of water to cool the computer down.
Yeah.
Quite startling, isn't it?
It is, although I know that's a generalization, but it really does depend on where your server is. So if your server's in the Middle East or in the US and it's in a southern state, it's going to need a lot more water than that, Steve. But if it's in Scotland, it might need less water. But as a generalization, it gives you an idea of the intensity of the resources needed for AI at the moment.
Yeah. David, do you want to mention the next couple for me?
Yeah, sure. So Diane said, we've got an innovative mattress that's recyclable and has a very long useful life and could replace foam mattresses in both acute and community settings. How can we present this complex argument?
So I think what you've got to be looking at is what are the avoided emissions on that? That's scope 4 I talked about at the beginning, because if you've got a mattress which has got a life cycle analysis which is longer than your standard mattress, number one, and if it displaces the use of new mattresses over that period of time, say 3 or 4 times, then you have to put that as an assessment to say, our mattress will have this carbon footprint, but it will avoid the use of X number of other mattresses will have a bigger carbon footprint. And you have to show that in your report. So it's called avoided emissions that you'd be working against on that one.
Apologies for just rumbling in. That makes perfect sense. Apologies, I had to join the call late. Who wants to hear that? That's the bit I might have missed, because we're trying to talk to sustainability teams as well as the clinical teams as well as the overall procurement teams, and the message just doesn't seem to be relevant to them. They're like, well, that's not our problem, well, that goes over there, that's not on our books, we don't really think about that. And I'm like, surely someone must be able to see the whole message, and that's the bit I think we're missing. So apologies if I've missed that in the previous.
Let me come in there, Gary, because I believe, Diane, we've had some interaction, haven't we, in the
We
past?
have.
Yeah, hi.
Hi.
Could you and I pick that up offline? Because I think it's
Definitely,
about having the value proposition really clear to all the different audiences. And you're right, it's really easy for people to be curious about stuff, much harder to get them to care about it. So could you reconnect with me? I'm off next week, but the week after, if that's okay.
Thank you very much.
And if we need to bring Gary in for any specific things, we can. Is there any more?
Yeah, just one. And also, I'll just mention that our ICB colleague Alison's popped something in the chat. There's some useful resources there. So yeah, the other Q&A question, the EU are looking at implementing a minimum of 30 to 40% raw materials to be locally sourced. Are you aware of a similar project in the UK?
No. So the EU has changed its policy on this because it was driven by the globalization of materials coming into the bloc. What's happened only recently is that they're changing the stance on this and also on forestry materials as well, agricultural materials, because of the complexities of trying to find the materials within Europe. It's been a bit of a challenge. So they're in a flux at the moment where they're trying to relax the rules a bit. Generally speaking, the UK, because a big part of its deal with the EU going forward, will probably match any standards that the EU does, particularly around food and materials.
Is that all the questions addressed, David?
Yeah, unless there are any in the chat which I've missed. That's all.
No, I've been looking at the traditional chat, not the Q&A. So
okay, yeah, that's fine then.
Okay, well, just a couple of closing remarks for me then. First of all, so thank you, Gary, David, and Paul for all presenting today. I just want to thank Phil Wright, one of my colleagues. He's helped me plan and deliver this workshop. We will be sending out today's slides and a copy of the recording of this workshop and our contact details. We hope you found it useful. I suspect you have, because we had 55 people 10 minutes into the call, and 50 minutes later, we've still got 49. So, so yeah, this is, we hope you found it useful, and just reach out to us with any requests for support or advice. And I think if it's all right with everyone, I'm going to say thank you for attending and have a good afternoon.
Is Alison going to say something?
Thank you.
Alison, did you want to say anything? Sorry, I think.
No. Well, I was just saying, I was just putting a few things in the chat just to show the significance of suppliers and the opportunities of working with suppliers to reduce the carbon footprint of the NHS. There's Green Plan leads in each of our trusts. Some of them aren't dedicated, they've got other roles as well. I'm the ICB Green Plan lead within Lancashire and South Cumbria. More than happy to link in and give advice. I'm not a procurement expert, but I am involved in a number of procurements, and the green agenda, the carbon reduction plan requirements are at least 10% of all our procurements from now on. In terms of the questions asked, so it's getting more and more significant. And I put the chat into the chat there around the roadmap as well, the supplier roadmap that we need to comply with, and we need to report on it to NHS England. So that's also just to highlight that.
Great, thanks, Alison. Right, everyone, I'll say good afternoon.